Mr. Speaker, I rise today with great concern for the people of New Jersey and the future of our country. Project 2025 puts our healthcare access at risk. The conservative pledge would impose lifetime caps on Medicaid benefits, putting coverage at risk for nearly 1 in 40 New Jerseyans. It also raises prescription drug costs for almost 500,000 residents by eliminating Medicare out-of-pocket limits. Even worse, it would block the government from negotiating lower drug prices, lining the pockets of pharmaceutical companies at the expense of our most vulnerable communities. The attacks on Medicare and Medicaid would be devastating to Black and low-income people's access to vital health care. Black women, especially Black expectant mothers, who already are facing among the worst infant and maternal mortality rates in the developed world, would face even worse outcomes. The criminalization of abortions, tracking of miscarriages and stillbirths, and restrictions on access to Plan B would impinge on the freedom of Black women to make their own decisions and eliminate their health care options. That's not all. Project 2025 would eliminate programs like Head Start, which provides critical care for child care for children, over 12,000 children in New Jersey alone. It would force 167,200 student loan borrowers to pay thousands more each year and dismantle the U.S. Department of Education, cutting vital funding for schools serving low-income students and putting nearly 4,000 New Jersey teachers and their students at risk. Project 2025 just isn't a political pledge, it's a direct attack on families, our values, and the future of our country. I urge my colleagues to stand together against the dangerous assault, and let's get back to work for the not for the uber wealthy and mega corporations behind the 2025 agenda, but for the people. Thank you. Mr. Speaker, in 2023, we lost over 50,000 people to suicide across the country. This year, more than 1.6 million individuals attempted to take their own lives. These deaths of despair disproportionately affect some communities more than others. Systemic issues, generational trauma, racism, economic disparities, and historical oppression have compounded mental health challenges, leading to an environment that has been devastating to our Black youth. For example, between 2007 and 2020, the suicide rate among Black youth ages 10 to 17 increased by 144%. And from 2018 to 2022, the suicide rate among Black youth aged 10 to 19 increased by 54%, while decreasing elsewhere. Every life lost to suicide is an incomprehensible tragedy, and the heartbreaking truth is that these deaths are preventable. That is why it's so important that we act. Our choices can make a real difference in people's lives. We have a responsibility, especially here in Congress, to ensure that resources and support are available to people who need help. In 2019, I chaired the Congressional Black Caucus's Emergency Task Force on Black Youth Suicide and Mental Health. The product of that task force, the Pursuing Equity in Mental Health Act, would provide resources to increase access to mental health care among America's youth, as well as help train a new generation of culturally competent mental health professionals. No matter your race, your background, or your gender, each one of us wants no praise for our children to grow healthy. When we see them struggle, we struggle. When we see they're in pain, we feel that pain deeply. Democrat, Republican, Independent, it does not matter. But it doesn't have to be this way. Children who have access to help can thrive. They've shown an ability to bounce back and become strong, happy, and resilient, to be active and productive in their communities. We can create the conditions in which all of our children have a shot at happy, fulfilling lives. All that is required is for us to break through the partisan gridlock. Our children and grandchildren's lives depend upon it. Mr. Speaker, I yield back.
Gentlewoman yield.